Professor, we have Edward and also Bill. Edward, would you ask question first?
Yes. Yes. It seems to me that this rapid antigen test is a very good thing, but it's not widely available in the United States, or at least not used. Why is that?
Well, I can only guess that the reason it's not being used is for issues related to liability and a whole series of other issues, and the fact that the United States is able to afford the PCR tests which they're using. PCR tests are considered the gold standard. If you're diagnosed with those tests, you're sure to have infection. However, if you're diagnosed with a rapid diagnostic test, there will be some people who are infected who are missed and who could transmit to others. And at the same time, there are people who will be infected who can be isolated. So there may be many reasons, but I would expect the two are that the US can afford PCR tests, and they would be concerned about missing a diagnosis using a rapid diagnostic test, which could lead to legal problems in the US.
Bill, please.
Well, my question is very similar. I'm aware that in the UK, these rapid tests are widely available. Our daughter is living in the UK, and she can just pick up free at the university where she is. She can pick up free handsful of rapid tests and tests herself every day when she's visiting us to make sure she doesn't transmit to her elderly parents. In the US, there is nothing like that. When we first started, the US, as you know, had a false start in producing tests that really didn't work while other people had working tests. Why can't we have international sharing of what actually works?
Well, as you know, the World Health Organization does share information. And then it's up to countries to use that information to make their own decisions. Also in the US, there's a very difficult situation, which has become a political situation in many instances for COVID-19. And therefore, it's been very difficult for the US, for example, to have standard policies. I think the same is true globally. If you look back to the SARS outbreak in 2003, there was great sharing of information and willingness of countries to work together. That's absent today in the COVID-19 pandemic. And I don't think anybody can really explain why, except that this has become an issue where politicians have put themselves many times in front of the public health workers who have the knowledge and are making decisions on their own.